everybody. Welcome to the Mom Pod. I'm your host, Brooke, and today I have with me Angelica. Go ahead and introduce yourself.
Hi, my name's Angelica. I'm from Las Vegas. I'm a new mom. I have a 16-month-old, so I still consider that postpartum.
Mm-hmm.
I think
Yeah.
everything is pretty new. Um, and we're here to talk about my experience during postpartum.
Yeah, it's gonna be a heavier conversation today. So just wanna give a little bit of trigger warning to anybody. We're gonna go kind of deep into postpartum depression, anxiety, psychosis, things along those lines. So if it's gonna be too heavy of a topic, just to give you a heads up. Um, but definitely want to jump to the end if you want to hear the product review because we got a really good one today. But yeah, so it's so great to meet you on here. And
Thank you. You too. Thanks for having me.
yeah, of course, I'm so glad that you were wanting to come on because I do think it's a very important topic to talk about and not talked about enough, I feel like. So I'm ready to dive into it with you on it.
All
So,
right.
all right. So, can you take us back to this just the first couple of weeks after having your baby? Like, what is it that you remember the most?
Well, as happy as I was that I was able to, deliver him safely,
Mhm.
I was also very anxious because I delivered him via C-section,
Okay.
which was planned, so that wasn't a surprise to me.
Well, that's good.
And I had a healthy pregnancy, so overall it was smooth sailing
Mhm.
until the doctor said, "We have to bring your baby to the NICU
Hmm.
because of he had I had a meconium birth. I'm not sure if you're familiar, but
No,
that's
I'm not.
when they swallow a little bit of their own stool and
Oh.
inside of me, I guess.
Okay. I
And
have
that
heard of that,
made
I didn't know that was the name, okay.
yeah, meconium. That was also the first time I heard of it. And it made his lungs like sticky. So
Oh,
he had really low oxygen.
oh,
So
okay.
just imagine being on the table, laying down on the table. I mean, I was helpless, of course. I
Of
was numb
course.
from the waist down. And then my husband was like, kind of confused, like, where do I go? To
Right,
you or
who
the baby? And I said,
right.
"Babe, go to the baby, follow them.
Mhm.
Please
I'm in
go. I'm
safe
fine. I'm
hands.
fine."
Right.
Because they were still like closing me up.
Mhm.
And, he was in the NICU for 7 days, although that's, short compared to others.
Any time in the NICU is a long time.
It
I
was
can't
such a long
imagine.
time. Um, then he got discharged. But then, of course, my anxiety kicks in. What if they discharged him
Too
too soon?
soon. Mhm.
So we take him home, and I'm like, I'm not sleeping. I'm
Yeah.
watching my baby breathe.
Oh, man.
I'm making sure that he's alive. I'm watching his chest, like,
Rise and
you
fall,
know,
100%.
exactly. I was like, I'm not gonna sleep. I'm not gonna sleep. Whatever happens, I'm not
Mhm.
gonna sleep. I was drinking coffee at like 2 a.m. I was just watching TV just to keep myself up.
Yeah.
Um, and my husband would be like, come on, like, go to sleep. He's gonna be fine. I'm like, nope, nope, nope. And
Yeah,
I was so obsessive with making sure he was breathing.
yeah, I can
Um,
imagine.
so I didn't sleep for 2 weeks, which, I would sleep like 5 minutes, 10 minutes, very light sleep. I wouldn't go into that deep, relaxing sleep that we all
Mhm.
need, obviously.
Yeah.
Um, yeah, but I think eventually that's what led to my, you know, more anxiety,
Mhm.
depression, and then eventually into psychosis.
Oh my goodness, I can't imagine. I mean, I had a C-section myself that wasn't planned, and just the anxiety of that alone was so
Mhm.
much. So I can't imagine also having to then go into having a baby right into the NICU and not having those first few moments. I mean,
Yeah.
I so scary, and yeah, I can't even imagine. not
It was
you're already
really
not sleeping because you have a newborn, and it's hard enough to sleep with a newborn, but then
yeah, and then recovering from the C-section.
exactly, it's so,
It was
so
like
difficult.
but I
And
was determined to make sure that he was alive, he was
mhm.
safe,
And your
even if,
body
you
goes
know.
into this, like, crazy mode, your brain does too when you're a mom, like,
Mhm.
everything turns from, "It's not about me anymore, it's only about this baby,"
Yeah,
and that's, like, on overdrive when you have a
yeah.
baby that already went through something so intense in the first few minutes of being out of your body, so
That
I
was my mentality. I'm like, "I don't care about me, I
mhm,
care about my baby, and the only thing that matters right now is he's alive.
right.
He stays that way,"
Mhm.
to the point where my body was like, "Hey, no, you need to take care of yourself too."
Yeah, like, you're
And I
shutting
learned
down.
that the hard way. I was just it was hell. It
Unwell,
was
right.
hell. That's how I
Oh.
would describe it.
Yeah, I can, so when did you first realize that something wasn't right?
Um, I guess after the couple weeks that we were home, I just felt like I would wake up anxious. I would go to sleep anxious. I would have even if I would get sleep, my dreams were very active,
Mhm.
very scary. It's always like someone dies, someone is chasing me. It's
Yeah,
always nightmares. So I was like, okay, I can't even look forward to my bedtime because that's not a relief.
right.
And then I would wake up, shaking. I would just be like this, and I eventually was like, I felt like at that time I felt like, am I awake or am I asleep?
You didn't even know. There was, like, a line
I
that was
didn't even
blurring.
know. So looking back now, that's when I can pinpoint my psychosis has started
Oh, okay.
because I would be alone in a room. I would hear someone call my name. Sometimes it's loud,
Mhm.
sometimes it's a whisper, but like it's a close whisper.
Okay.
And
Wow.
then around like 3 a.m., 4 a.m., I also had hallucinated smells.
Oh, wow.
Like strong coffee, like in my face, coffee scent, which would normally smell amazing, right?
Right,
But
normally.
it was so random that I'm like, it was so random and so strong that it would wake me up at 3 a.m., 4 a.m.
Wow.
So I'm like, I would wake up from my nightmare. So I'm
Mm.
shaking. And now I'm
Yeah.
like, where is that coffee
Where's that
coming
coming
from? Or
from?
sometimes it's popcorn and sometimes it's flowers. I love the smell of all of those,
Wow.
but
Right.
it was just like so strong, so in my face. And you're just wondering, like, popcorn at 4 a.m., like everyone's asleep.
Right. Where's this coming
Flowers,
from?
where's the flowers coming from?
Right. Oh my
And
gosh.
it was just so waking up to that from nightmares, I'm already like, oh my gosh, when do I get relief? When do I
Yeah.
get relief? So I remember one Friday morning, I was still on maternity leave, and then my mom was over, and then my husband was about to go back to work the next week. And I was like, oh my gosh, when my mom goes back to work, my husband goes back to work, I don't think I can do this alone. I don't think I can trust myself to
Oh,
take care
right.
of the baby. So I told them, I'm like, Mom, babe, something is not right. I need
Wow.
to go to the emergency room because I
Mm.
had read about psychosis before.
Mhm.
But then they're saying it's 1 in 1,000. It's
That's not as
rare.
common.
So I'm like, okay, you read all the baby books, pregnancy books, and then you see that, and you're like, oh, 1 in 1,000. What are the chances?
Right. It's not gonna
What
be
are the
me.
odds? Like, come on, of course.
Mm.
So I remember reading that, like, once you experience this, hallucinating all, like, even one to two of the five senses that they were talking about,
Mhm.
seeing, hearing, smelling, feeling, whatever,
Mhm.
um, it's an emergency.
Yeah.
So I said,
Wow.
okay, this is an emergency. I need to go to the ER. my mom took me, and
Okay.
then, you know, it's it helped for that
Mhm.
day. They
Okay.
gave me an IV with, benzo. I
Okay.
think it was Ativan through my veins, and then that helped me get some deep sleep for that day.
Right.
But as soon as I wake up, I'm like, "Oh my gosh, I
Right
have
back
to deal
into
with
it.
this again. I'm shaky
Yes.
again. It's like back to square one." And of course, they also recommended me to go to therapy, like
Right.
talk therapy.
Mhm.
And I'm like, I don't know. Like, I'm all for that, but I'm like,
Right.
in my condition right now,
Yeah.
I can't
How
talk
is
this
that going to
out.
help?
I can't. I I can't. Like, I
Yeah.
need something more. So I went back to my OB. They gave me Zurzuvae. It's this 2-week antidepressant specifically for postpartum.
Okay.
And it's got good reviews. Um, and new moms are saying like, "Oh, this is really effective. I started feeling better after like the first week because you only take it for 2 weeks."
Okay.
And then I was really counting the days, but within those 2 weeks, I finished all of it. I started getting panic attacks.
Oh my gosh. Is that a
So
common side effect of that medication?
they said it could be,
Okay.
but they were like, "Oh, we have good reviews, we have good feedback on this drug. It helped a lot of moms." And I was reading online about it, and people are like,
Mhm.
"Oh my gosh, this is godsend, whatever." And I'm like, surely this will work well for me. But it didn't. So I go back to my OB and they put me on Lexapro. And I was like, okay, I'm really feeling hopeful.
Yeah.
After 3 weeks, gave me more panic attacks.
Oh my gosh.
And then that's when I really begged my husband. I'm like, I maybe I'm hopeless.
Yeah.
Maybe this is not maybe this is just how I feel now. That's how I believed it.
Oh my
Because
gosh.
how come it worked? How come it's got good reviews? It worked for so
Right.
many women. How come, you know, they made it through? They felt better at this point after
Mhm.
taking it for after a week. And I've
Mhm.
already been on these medications and I still feel like crap.
Yeah, and that's not working for you.
And it's honestly made me feel worse because
Worse.
I was anxious about having a panic attack. And when
Oh
I have a panic
gosh.
attack, I was anxious of I would be carrying my baby. I'm like, what if
Yeah.
I get an attack then and I drop him and
Mhm.
I was just it was piling up. Like the
On top.
things
Oh
that
my
I was
gosh.
anxious about, it was piling up
Just
and
piling
piling
up.
up and piling
Wow.
up. Yep. And eventually, with the help of my whole family, my husband, my sister really researched like what treatments are available.
Mhm.
My husband and my sister eventually found ketamine IV for
Mhm.
immediate relief.
Okay.
So I had 6 sessions of that.
Okay.
And I feel like everyone in a current crisis like that was, if they want
Yeah.
immediate relief, like just like a sense of hope and relief, I would recommend that.
Yeah. That's
And
I
it's
mean, I never even heard of that. That's crazy. I mean, it's amazing that it worked.
I wish that's offered first.
Yeah. I guess
I
it's one of
really
those, like, save for extreme circumstances, but again,
Yes,
I mean, if you don't know that it's even an option, how are you gonna know when you need
exactly.
to
But
express go
also,
for it?
it also depends if the mom is breastfeeding. So I never got to breastfeed really. I
Okay.
tried, but it was just like too much for my
It
body,
that
too
is
much for my
alone is so mentally taxing and
Yeah. And
physically
then the
too,
guilt.
but this, like, adding that onto everything you were already going through, I
Yeah.
can't even imagine doing that. So, I'm glad
Yep.
that you were able to listen to your body and take care of what you really needed to take care of. Because at the end of the day, your baby got the nutrition that he needed, and
Yeah,
it does not matter if it came from you or if it came from a can of some kind.
exactly.
So that is good for you for being able
Thank
to
you.
go through with doing that, because I know it's so taxing. I had my own like breastfeeding experience that ended not great. So like I it's hard.
It was really hard. And then, of course, like not being able to do it,
Mhm.
there's that guilt.
Yeah,
Like,
100%.
is my baby getting the nutrition that he needs?
Yep.
Is my baby eating enough? Like, what's in this formula?
Mhm. And, like,
Is it
breastfeeding is so
poison? Is it
glorified right now, and which is
uh,
great. Like, I'm not saying it's a bad thing. I think it's a fantastic thing if you're able to do it, but if it's something that is going to kill you more than just getting the formula off of the shelf, you can
mhm,
do a ton of research into the form. There's so many options for formula now than there
right.
were when like we were younger. I
Mhm,
was born in the 90s. There were two options for formula, and that was you get what you get. And now it's like I can't even tell you how many options there are. So you
there's a
can
lot.
do the research and find what works, aligns with you best, and what works
Mhm,
best for your child. And it's like it's so hard when you can't breastfeed. I was able to at first, and I lost my supply. So I was like doing great, and then suddenly I couldn't. So that
mhm,
turn was mentally taxing for me. I went through a little bump of I don't wanna call it actual depression, but it was kind of leaning towards that for me, um,
mhm.
and
Well,
it's
because that's
hard.
another hormone drop.
Yeah, and you see so many people who are able to do it, and you just think, "Why not? Why can't I? What happened to me? What's wrong with
Yeah,
me?" So to add
why
that
isn't
on
my
to
body doing
exactly, and to just add that on to what you were going through, oh my gosh, just amazing that you were able to pull through that on there.
Thank you. Thank you. It was actually a blessing that I did formula for him because after I did my IV ketamine treatments, I can't breastfeed him because of that.
Hmm,
And then the trial and error of medicines that they had put me on, I don't want to breastfeed with that in my system. I don't know
right.
what that's going to do. That
Mhm.
was more scary for me than feeding him formula.
Yeah,
Like I can't give him my milk if that's
if you
already
don't
has
know.
all these drugs.
Yeah.
So,
And mental
and
health
then
medication alone is something that is such a fine balance, and it's
exactly.
so complicated to get 100% right. It
Mhm,
takes so much time
mhm.
and like really fine tweaking. So that's definitely not something that you want, you know, going through your child on top of that when you're still
Exactly.
even trying to figure out what works best for you.
Exactly. But aside from the ketamine IV therapy that I did, I also did TMS therapy. Are you familiar with that one?
No, I'm not.
So it's this helmet that you put on your
Oh.
head and it's like a tapping magnetic tapping
Oh,
thing.
okay.
It zaps your brain. I forgot what it stands for. Transcranial magnetic something. But I did 36 sessions of that while I was doing ketamine IV. So 6 ketamine IV treatments and then 36 TMS
36.
treatments.
I've
I was
got it.
there
It's,
every day.
transcranial magnetic stimulation.
Yes. So what that does is it helps with a bunch of mental disorders
Okay.
because it helps your brain create new neural pathways.
Wow,
And
okay.
the depressed part of the brain, it stimulates it. So like
Mhm.
the magnetic thing does its job where it's like, okay, like this part of your brain like needs to wake up.
Wake up, right. That's
That's
so
how they
cool.
explained it to me. I
Yeah.
can't scientifically explain it because I don't really know, but I know that it worked. It's got long lasting effects.
Wow.
And but an important point that I'd like to touch on, medication wise, after those medications, made me worse, my husband told the team of doctors saying, let's do a genetic testing for my wife and see what medication will work best for her genetic makeup.
Whoa.
And it's not covered by insurance, but it's around like $300. My
Okay.
husband's like,
That's
let's
really
do it,
not an insane amount of money for something like that.
It's
So
not, but I wish
it wasn't
they
covered.
do
It
it.
should be.
I wish it was covered, but I also wish they mentioned that first
Right. I didn't
instead of
even,
giving you Lexapro.
yeah.
Okay, so it's so easy. Like they just swab your cheeks, the
Yeah.
insides of your cheeks, send it out to the lab. You get the results back within like 3 days. Um, and you'll see best to worst drug for
Wow.
your genetic makeup. Guess what? SSRIs are so bad for me.
Yeah.
So the Lexapro, everything was
Wow.
meant to give me panic attacks.
Yeah. I mean, wow. That's crazy.
I'm
Oh my
like,
gosh.
this should be offered first. Even if it's not covered by insurance, at least mention it to your
Mention it as
patient.
an option
Like,
because I mean,
yeah,
yes, $300
exactly.
is a chunk of money. It's not a small amount of money, especially to someone who is like, just making ends meet. But it's also not an obscene amount of money on the same
Yeah,
aspect where like if I was going through something like that, my husband would 100% without a doubt be like, do whatever, take the money, like
exactly.
get this straightened out. Like it's
Exactly.
not like, for example, like I have to have a graft done on my gums and it's like 4 grand. It's nothing like that,
Mhm.
so it's
Yeah,
something that is it's attainable in some way, and it
yeah,
should definitely be mentioned. I mean, they
I
mentioned the genetic
think so.
testing when you're getting the baby, you're just pregnant. They mentioned genetic testing for all of possible disorders,
Exactly.
disabilities, and things for the baby. Why can't they also offer that for mom after the
Exactly.
fact? That's wow.
Exactly.
Yeah.
So, yeah, it turns out all the medications that I was put on were the worst for me.
Wow.
So it's like they have it in categories, like best, worst, and then just neutral.
Right.
All those medications I was put on postpartum, freshly
We're
postpartum,
wow.
were just not
The
compatible
worst.
with my body.
Wow.
So we find out there's a list of medications that are best for me. Hallelujah. We got the medications, that were right for me.
Right for you.
But before we got to that point, um, I was feeling hopeless and I told my husband and my sister and my whole family pretty much. I said, "Listen, something's not right. I think I need to be in a hospital. I think I need to be like somewhere. I need to be monitored. I need to be somewhere. I don't know what that looks like."
Yeah.
So they research. There's not much in Las Vegas that could help me. So we saw this place in Utah. And I was supposed to be there for 30 days, but
Wow.
I was only able to make it those 4 days. But those
Wow.
4 days were so helpful because over there they tested me for blood work
Mhm.
and they found out that my thyroid was so low.
Oh, and that's so common with
And I'm like,
postpartum. It's like, why isn't that the first thing that people test for sometimes?
well, I did ask that. I did ask my OB that, and she said because postpartum it fluctuates so much, so you won't
Yeah.
even get an accurate reading. But at this point, I was like 4 months postpartum.
Yeah, at that point, you should have an accurate enough depiction of what
Yeah,
your thyroid is doing. Like, you're still freshly postpartum, but you're not, like, in the thick of it, you're healed
yeah,
up for the most part doing normal daily things, and your body should be relatively back to the
yeah.
chemistry at least should be relatively back to a semi-normal depending on breastfeeding and stuff, but
Right.
wow. Well, I mean, it sounds like you had an incredible support system with you.
Oh
I
my!
mean,
I am so blessed with
yeah.
my family, my husband. Because when I got out of the facility, my parents said, "We'll take the baby for now. we live super close. They're also in
Okay.
Vegas. We
Yeah.
live like probably less than 10 miles away from each other.
That's great.
So they're like, we'll take the baby for now and you rest, you heal, do whatever you want, do
That's
whatever
so
you have to
amazing.
do. And that really helped
Yeah.
because I didn't, like his cries were always making me anxious
Mhm.
because he was also a colic baby.
Oh, no, not to add on
It
top
was
of
a perfect
everything.
storm. It
A
was just a
perfect
perfect
storm.
storm. So his cries were like, "Oh my gosh, is he hurt?"
You couldn't even
Like
decipher what they were at that point, I'm sure, because of
I
everything else going
couldn't because
on.
you go through the checklist. He's dry. He's fed. He's burped. What
What
else could
else
it
do
be?
you need? Like,
So I'm like, okay, maybe he's in pain. Maybe he can't breathe. I always go back to that breathing because he
mhm.
was in the NICU, right?
Yeah,
So I was like, can he breathe? Let's go to the ER, blah, blah, blah. I'm like, I think
yeah,
we have to go. We have to get some help. Um, but yeah, it was really tough. But when my parents offered to do that, it helped me a lot. It helped
yeah,
me really rest my mind and rest my body.
yeah.
I
That's
didn't even
so
feel,
important.
I hardly felt my C-section incision because it was
Everything else.
overpowered by
Yeah.
everything that was in my head.
Yeah. Wow. Well, I'm glad that you were had that. I mean, that system, because that was gonna be my next big question for you is if you felt like you could talk openly about it, and it seems like you did. I mean, you went straight to the people who you knew you could trust and said, "This is something is wrong. Help me fix it." And
Mhm.
they want without even questioning you, just what do we do? How can we help? Diving in to do research and to take you to these places. And I mean, that's absolutely amazing. And I'm so glad that you had that because not everybody does.
You're right. Yeah, I was very I mean, even before this, me and my family have a good relationship. We have an open communication,
Yeah.
sometimes too open,
Yeah,
but
I understand. I feel that. I'm the same way. I get it.
like I share everything with my mom. What's
Yeah,
wrong with that?
that's my best friend. I don't she knows
Yeah.
everything.
So I didn't really feel like it was hard to be open to them. Um but yeah, I mean they understood and they honestly they dropped everything. All hands on deck at that point.
They knew how
All
serious it
hands on
was.
deck. They knew how serious it was. Also, my one of my sisters, she's a therapist, so she's
Oh,
familiar with mental disorders and just mental health care in
in
general.
general, yeah.
And
That's great to
she
have.
was, yeah, um, yeah. So I can be open about. I was open about it to my friends. I trust them. They never judged me. No one left.
Mhm.
Everyone was really you know, sending me good thoughts, good like prayers and dropping off
Goody bags.
flowers and snacks, sending nice messages. They were there for me and up to this day they're always like, "Are you okay? How are you
Yeah,
doing? Do you need help?" And that means a lot to me. I wouldn't be here without them,
yeah,
especially my mom and my husband.
yeah. Oh, my heart goes out to you for that because I know I've seen stories and things of people who just don't have that, and it's like
Mhm.
I can't even fathom not having that because I also have such a close-knit family, and I know that
Yeah.
if I were to ever go through something like that, I would be able to tell them and it would my burden would become theirs and we would just everyone would
Yeah.
fix it together. So it's just great that you were able to have that. And I can't express how important it is to not hold things like that in. I mean,
Mhm.
it's just I've seen people hold it in, and it just tears them apart even more than they're already being torn apart because they
Yeah.
haven't it's condensed into your own brain, and
Mhm.
as hard as it is to talk about the things that you're going through, it is so helpful just to let it out and
Mhm.
and try and just, like, get somebody else to not necessarily understand, but to at least know what's happening in your own brain so that they can
Mhm.
try to help you through it the best that they can and get you the assistance that you need, even if it's not them exactly, but finding whatever it is to get you through that.
Right, exactly.
Um, so you kind of already went through what your days felt like with dealing with all of these, and you've kind of talked about that jump when you realized it was going into psychosis. So can you kind of like I guess explain that jump a little more when it goes from just like the depression and anxiety straight like into that? You said it's like the
Mhm.
hallucinations with the smells
The
and the hearing
hallucinations.
things.
Right. The most scariest thing was, and I still remember this vividly because I once this happened, it happened multiple times and I paid attention. At least as much as I could.
Yeah.
I remember I would fall asleep on the couch, and whenever I would wake up, I would be in bed
Oh,
with no recollection
how you got
of
there.
how I got there, what happened in between, what day is it? Like, I would wake up like, oh, it's morning. But when I was on the couch, it was nighttime,
Mhm.
or vice versa. And I'm just like,
Where did that
just
time
so confused.
and what happened in that time frame? Oh my gosh.
Exactly. Like, what did I do? What did I do? Where's my baby? Because I've heard
Oh,
stories like this before.
I
I'm just like, it's
wow.
scary, it's real, it's not a choice.
No.
So if someone, says something is wrong, help them, believe them, help them. Because to lose control over your own body and mind,
Oh,
it's it's scary. Just
wow.
imagine. I'm not sure if um you drank or you've drank
Oh, yeah, I
before.
mean, I was all I could think about for that 1 second was, like, the one and only time I've blacked out and I woke up in a different place than I was, and it was how frightening it was to me, like, "How did I get here? What did I do in between?" Like, that
It's like
alone,
that.
and I can't imagine going through that not with alcohol involved, because at least when alcohol is involved, you would know, it's like, "Ugh, it was the
Yeah.
alcohol," like, "I can't
Yeah,
believe I did that,"
exactly.
like, I can't believe I've let myself get to that point, but
Exactly. But you get over
there's
it
an
after.
explanation.
Yeah, exactly.
With this, there's no explanation, so it's
There's
like
no explanation. And also you have a newborn that you're like, is he safe?
yeah, that would be my first thought, like, "Oh my god," like you said, "Where's my baby? What" like, I if I had done oh my gosh, I can't even put thoughts together because that's just so
And
crazy, so
there will be
scary.
times like it's like the house is quiet. Is he okay? Is he
Mhm.
sleeping? And I would always obviously run to the nursery and I would just see him and my mom, playing, or maybe he's sleeping. He's safe. He's totally
Yeah.
safe. But like feeling that too often, you're just like, oh my gosh, when can I rest? When can I
When
like
can I
feel
just
feel
not?
exactly? So that was a lot. That was ugh, I would not wish that on
Not your
anyone.
worst
It's
enemy.
nope, nope.
Wow. But you're doing so much better now, right? I mean, you've got the
I
medications
yes.
that you needed, and you have, again, we talk about the support system that is so,
Mhm.
so incredibly important. Do you ever feel like it tries to sneak its way back in almost, or like how do you kind
Um,
of manage
s-
that?
so right now I'm like real I feel really stable. I
That's
feel like
great.
I can navigate, the harder parts of being a mom. Um, but I see my psychiatrist and my team of doctors every 3 months. I
Okay.
can always see them sooner if,
Sure.
I need a little more support. But before I was seeing them every month, every month, every
Right.
month. And then around February, they're like, you're doing good. Do you want to move this to every 3 months? I'm like, yeah, I think I'm doing good. So I'm still being monitored by them. I like my medications. They keep me stable and,
Great.
we're entering toddlerhood. So I'm like, let me just keep, my medications for now because eventually I do want to wean off of them.
Sure.
Although I have no side effects, everything is good, but of course I want to see like what I would be
Able
what
to
I would
do.
feel, yeah, exactly, like how I would feel like without those medications.
Yeah.
But yeah, with the ones with the two that I'm on, um I've the anxiety is, I feel like it's
It's
going
always
to be
there.
there
Yeah.
because you're like,
There's always a sense of anxiety,
yeah,
especially when you're a mom and you're a first time
yeah.
mom. We're in the same stage of motherhood because I have an almost 18-month-old. So like I
Oh
can
yeah, we're almost the same.
so like you're talking about the toddlerhood and I'm like, yeah,
Yeah,
it's
help.
crazy. And
PCOS.
it's like that
Um,
anxiety is always gonna be there. You're like, I watch her like
there
try to get on a chair and I'm like, you're gonna fall. And like
yeah.
but she's like they're like little I don't even know. They just think that they should be on an episode of Jackass, every single one of them, because
Yeah.
they just
They're
throw themselves off
fearless.
of things. I'm like,
They're fearless and they
when
don't
does the
even
fear come in?
try.
When
I
does the fear
know.
come in?
I know, right? It's like, come on. But
So much.
yeah, anxiety is there, but it's not taking over my life
That's
anymore
great.
like
That's
it
amazing.
used to. Um, I'm not depressed.
Even more
I can
amazing.
determine, I'm like, okay, I'm a little low today, I'm a little sad today, but I'm not depressed because trust me, I
You
know
know the
depressed.
difference.
Like
Yeah.
I know the difference, especially now having gone through that.
Yeah.
Um, but yeah,
Good.
I feel really stable and I hope that it won't crawl back in.
Yeah.
But now, with all the treatments that I've gotten,
Mm.
if it ever comes back, I'm like, I know what to
You know what
do.
to
I
do.
know it's possible to get through it. And I know help is available. And I know that my family will show up for me and my friends.
Yeah. That's amazing. I'm so glad that you are still, you're still seeing the people that you need to see because with the mental health medications are so, like we said, so fine tuned and they can change like that. So it's great that you have
Mhm.
people who are looking out for you and making sure that they are keeping tabs on how it's treating you and that they don't need to make any kind of adjustments or anything. So it's great.
Right,
I'm so glad that it's
exactly.
working so well for you and that you found
Thank you.
your rhythm because it's I can't I know I've said it a million times, but I really just can't imagine how that is. I mean, wow. Is there anything that you would want to say to any mom that it might be struggling with these at the moment and battling these disorders?
I would say help is available, but that doesn't mean anything if
Mm.
you don't speak up.
Right.
You have to be honest with the people around you. When something doesn't feel right, it's because something isn't right.
Mhm.
First step to getting help is really being honest and speaking up because that's what I did.
Yeah, it really is.
People
It's
around you wouldn't know how to help you if they didn't know you needed help.
right. Yeah, it's
Don't
like what they say. I mean, this is not the same thing, but like with AA, for example, it's like the first step to correcting something is admitting that there is a problem.
Mhm.
And I feel like that just is works for literally everything in life is
Everything.
the
Yeah.
first step in correcting anything is admitting or being able to at least acknowledge that there is something off kilter.
Mhm.
And
Exactly.
that's a huge thing that but it's not even just like acknowledging it for internally, like you said. You have to
Mhm.
lean on your village and
Mhm.
reach out to the people that hopefully you have in your corner. And if you don't have maybe the support directly in your physical corner, there's so many corners of the internet. I mean, there's so many mom groups and
Mhm.
doctors groups, just so many things that you can, even if you just need to go in anonymously. I've seen it all over the place in all the groups that I'm in online. People
Mhm.
posting anonymously, just saying, "I'm going through this X, Y, and Z," and they feel like they can be a little more open because they are not posting with their names maybe, but they
Mhm.
get the help and the assistance that they need from other moms online. Um, and I think that we live in this day and age where we have access to that, and while it can be so detrimental when you kind of Doctor Google yourself and you get yourself into these little, like,
I did all of
corners.
that. Oh my
Yeah,
gosh.
it can be not so great, but I
Mm.
think it's important to find the good parts of it, and it's okay to lean on that part of it as well if you can find a good
Mhm.
little corner to get yourself
Mhm.
into, if you don't have that
Mhm.
available to you by the people directly in your life. I hope every person would have at least one person they can go to
Mhm.
physically, but just in case, I mean, there are so many other avenues that you just sometimes have to look for.
Exactly. And keep looking, keep asking for help until you feel better.
Yeah,
Just keep finding it. Keep finding the right treatment for you. Keep speaking up. You have to advocate for yourself.
yeah,
You really have to.
because nobody else at the end of the day is gonna do it, especially if they don't know what you're going through, and even if you tell them, "This is what I'm going through," they can't fully advocate for you
Mhm.
because they still don't know exactly what you're going through no matter how much you try to explain it. You are the only person who truly knows every single aspect of what you are going through and what you are feeling, and
Exactly.
you're the only person who can really advocate for yourself. It's like with anything, if you are not willing to do it for yourself, it's not going to work. You have to be willing to make the changes and put in any effort to find those avenues for yourself and do what you need to survive.
I agree. Absolutely.
Well, this has been a really opening conversation for me. I mean, eye-opening for me because I had so many things that I just learned talking to you about this.
Thank
Amazing
you.
to hear your story and that you're so open to sharing it, and hopefully some other moms out there listening feel a little more seen and maybe have a few more ideas that maybe they didn't have before, or can take these to people that they know that might be experiencing this kind of situation. So
Mhm.
just appreciate you being so open and sharing everything.
Thank you for
Mm,
having me and
of
creating this
course.
safe space. I wouldn't be so open if I didn't feel like it was safe and if I didn't feel like it could, help someone,
Yeah.
hopefully.
Well, I'm glad that you feel safe here. Um, I am gonna ask you to lighten it up a little bit for the last couple minutes
Okay.
here. Got a couple rapid fire questions for you. Um, ready?
Dun dun dun.
I
Okay,
know.
I'm ready.
They're really easy, don't worry. All right. Okay, Target versus Amazon.
Amazon.
Mm, coffee or tea?
Coffee.
Would you rather stay at home or go to work?
Stay at home.
Yeah. Um, what has been the best age so far within month-wise for the baby?
Best age of right now, 16
Right now?
months.
Yeah.
He's wild, but I'm
It's
enjoying it.
it is.
There's entertainment every day.
Dang, yeah. Okay, last one. Movies or TV shows?
TV shows.
Yeah, you can kind of binge them and make them a movie anyway.
Right, right.
Yeah. Well, that's great. That was fun, little mood lightener. And we want to go into our product. We want to talk about bottle washers. Those washer dryer sanitizer monsters that sit on top of your counter and do all the work for
It
you.
takes up all the space, but it does all the work.
It's
I
so
have
worth
this
it.
Bear brand,
Mhm.
and it does everything. You just put everything in there, and it washes, sterilizes, and dries.
Yeah,
So that helps a lot.
I had a similar one, wasn't that product or that brand, but I had the Mom Cozy, Clean Pal Pro. Did the same thing, clean, wash, sterilize, dry, and it was amazing, and it did
It's
take up a good
amazing,
chunk of space on the counter, but, oh, did it save my life when it was like, "I don't wanna wash all these bottles. I can't."
right?
And
Did
even
you
when I
ever
was
use
pumping,
Dr.
I didn't.
Brown's, the bottle Dr. Brown's?
So I tried them and they
Mhm.
did not work because they leaked too much. But they
Mm.
have so many pieces.
So many
So,
pieces. That's why
so many
the
pieces.
it helps a lot to have a, a washer that does everything.
Yeah.
Because oh my gosh, who wants to deal with those
No, and
pieces?
they're so tiny. I mean, even when I did have anti-colic bottles at the beginning because I didn't know if
Mhm,
she would get colicky or anything.
mhm,
But we had the Philips Avent anti-colic, and they
mhm.
didn't have, like, the long stick, like, pieces
Yeah,
like Dr. Brown, but they did have a separate piece inside of them to prevent that. And I'm like, there's so many pieces to this." When I was away from my house and I had to wash bottles, like, overnight away, I was miserable. I'm like, "This I miss my can I just take my
have to
bottle
use a
washer
little
with me
brush.
everywhere?"
Oh my, yeah.
I'm like, "I
It
will pack
was
space in the car just to take this with me
just for
because I
the
do
yeah.
not wanna do this." It's so helpful, especially with pump parts too, because, like I said was telling you, I did pump for a little bit and breastfeed for the first 4 months until I completely lost my
Mhm.
supply, and having to pump multiple times a day, and you don't
Watching in
necessarily.
between.
Yeah, I mean, if I got to a point where I didn't have to wash them every single time, like, if you just store them in the fridge and keep them cold, it's okay to
Mhm,
continue using them for
mhm.
a set amount of time, but, when you are washing them still, there's so many parts to a pump, and
I know, it's
it's
so tedious.
it's so
You have
tedious,
to make
so
sure you wash it well so it doesn't
yeah,
spoil the rest of your new supply.
exactly, and it's crazy, so I recommend those bottle washers to everybody I possibly can. I actually just loaned mine to a friend because she has a newborn, and I was like, "Use
Oh,
this
yeah, that
because."
would she would love that.
Yeah, because it's just, like, I don't care if it takes up all the space on your counter. You make
Yeah, well,
space for
it's
this.
temporary.
Yeah.
Yeah, exactly.
We were all too happy for it to be gone off of our counter. Once she hit a year old and we were no longer using bottles, I was all too happy to be like, "Oh, I have all this counter space back." But it was just such a lifesaver that I was like, "I don't even care." I mean,
Yeah.
it was so amazing. Not I would be like, "Just pack the bottles." When I went back to work and my mom had my daughter, I'd be like, "Just don't wash the bottles. Just give me the bottles. I'll take them home and I'll throw them in the washer when I get home. Just rinse them out and give them to me and I'll take them home." Just made life so much easier,
I
and
agree.
I can't recommend it enough.
It's like, your dishwasher.
Yeah, but you can't put the bottles in the dishwasher because of all the other food and
Yeah,
bacteria
exactly,
and crap that
exactly.
goes on in there, so it'd be nice if you could. Um, but yeah, I mean, mm, definitely definitely
Definitely
worth it.
recommend.
Definitely worth the money, and sometimes you can get them on a good deal.
Put it
If
on your
they're
registry. If you
Yeah,
haven't given birth yet, put it on your registry.
yeah, and if anything, people give you cash at your shower or anything, and you don't
Mhm.
get it, just put the cash towards it because
Yep,
you're not gonna use any other product more than you're gonna use that thing. You're gonna use it literally multiple times a day.
yep.
Every time, like, especially at the early stages when they're drinking, like, 12 bottles a day,
Oh
it
my
feels like
gosh. I
like,
almost forgot about that.
they just drink
It was a lot.
so many bottles, and they
And
like,
then it was
"Okay."
important too that they didn't have water spots in them because they couldn't drink water as a newborn, right? So
Yeah.
it's so nice that the machine dries it really
Yep.
well for you.
Mhm. Yeah. I mean, there would still be times where, like, when we had to clean our machine that we would get water spots on it here and there, and honestly, I
Mhm.
was just like, "Whatever." It's clean.
Yeah.
It is what it
It's
is, but
clean. Yeah.
when they're like yeah, you definitely need to try and keep a it's just great. Those things are great, and they do a really good job of it, so it's good that there's so many different products too, like you said, you have the bear.
I have the bear. It does
Yeah.
all three because I also had the I think was the Brezza,
Yeah.
but that just sterilized and dried.
Mhm. It didn't
And it
wash.
took
Yeah.
like it didn't wash, so I still had to wash it. And then once I got the bear, I'm like, "Oh my gosh. You just dump everything in there. It does all three steps for you."
You don't even have to rinse it out. You just dump it in.
Yeah.
It's so great.
Yeah, exactly.
Well, listen, thank you again so much, for doing
Thank
this.
you.
I'm so
Thanks for
glad that you
having me.
felt safe enough to have this conversation with me and share with all the other mamas. And I can't wait to keep up on how you're doing and follow along with your
Yeah.
journey. And
I'm
yeah,
following
so
you too.
yeah, it's gonna be great watching you guys keep blossoming, and maybe we can have you on again in the future
Yeah.
and for a
Just let me
little
know. I would
catch
love
up
to.
and see how things are going. I'm sure
I
people
would
would love
love
to
to
hear
come
that.
back.
Yeah, that's awesome. Well, in the meantime, everybody, you can find me at the Best Mom Pod on Instagram, so you can see all the updates on future episodes and things. And you can email any funny stories to me or any stories really that you want to share. Love to put them into the end of episodes or start some mini episodes up, and you can send those to thebestmompod@gmail.com. And other than that, I will see you guys next week. Bye.
Bye.